Rapid COVID-19 testing will soon arrive at Oklahoma senior care facilities, but not everyone is sure that's the best use of the new technology. Reporter Whitney Bryen is covering that story for our content partners, Oklahoma Watch.
So rapid testing is actually kind of similar to PCR testing, which is the test that most of us are familiar with, that nose swab, that dreaded nose swab that a lot of people joke tickles your brain. So it's very similar to that in terms of receiving the test, only it doesn't go quite as far up the nostril. A little less invasive, but also a little less reliable in the test results. So that's kind of the trade-off. The state's epidemiologist tells me the reason that you would want to get one of these tests done is it does help to free up some of the labs that are doing the PCR testing. We know they've been really bogged down, and some of those test results can take a week or even more to come back. Rapid testing, you can get tested and have your results back within an hour, maybe a couple hours, but typically on the same day.
This seems like a win-win situation for everybody. Nursing homes, though, have some questions about this.
The nursing homes are definitely happy that they're receiving some assistance. They're all jazzed about getting really any assistance that the government wants to provide. It's been few and far between so far. What we're finding is that as these tests are being pushed from public access to nursing homes, then the public is going to have, as I said, less access to these tests. And the nursing home executives I've spoken to have said, that's not good for the nursing homes either.
You've been covering the nursing homes from the very beginning. What's the latest on the numbers? Are we in a good place right now?
Monday's report says that we have about 375 active cases in nursing homes, and that's residents and staff. But there's a lot of concern that as nursing homes start to reopen to visitation, and as some of our hotspots around the state continue to move, that community spread is going to infect staff, visitors, hospice workers, and others who might be coming in.
Lastly, have the tests begun to arrive at nursing homes in Oklahoma?
The government does have a list of sites where these testing supplies have been allocated, and there are 11 nursing homes in the state of Oklahoma currently on that list, including Bartlesville Health and Rehabilitation Community. They've had the worst outbreak and the highest number of deaths in our state. So they're on the list to receive these testing supplies. We still don't know when that's going to happen, but it looks like Oklahoma has begun receiving some allocations.
Whitney, if someone wants to read your article, where would they go?
Well, they can go to oklahomawatch.org. All of our nursing home coverage and lots of other COVID coverage, including we've been putting out some weekly hotspot coverage based on zip codes. So you can find all that coverage on our website at oklahomawatch.org.